Michele Hauser. Dr. Hauser is a third-generation Texas psychiatrist who has been practicing in Austin since 1991. Michele practices general child and adolescent psychiatry with a focus on evaluating and treating individuals and their families as part of a comprehensive treatment plan for her patients. Her own personal practice of mindfulness meditation led her to co-found MBCT Austin to bring the nationally recognized mindfulness-based cognitive therapy course to Austin. And Michele, I'm really happy that you're here today. This is such a great topic to go over, how it affects us and how it affects our patient care. So I'm really looking forward to hear what you have to say today.
Thank you so much, Dr. Sayers. The program that I am going to do today, I don't know, Chantal needs to make it visible, or if it's already visible. But what I want to talk about today is mindfulness meditation. And let me go to my PowerPoint screen so that I can begin to tell you about why this topic is important. And it's a little dry for the end of the day, so I hope you're all still awake, but we're going to end with something a little more juicy. I think the reason that this is important is as physicians, sometimes we are suspicious of things that we don't know if they have a medical basis. And for myself, going to UT Austin in the 80s, it was kind of post-hippie era, and meditation had fallen out of practice. And about 10 years ago, I was under a lot of stress with being a single mom with 2 children, a full-time practice, and taking care of a ill parent. And I felt like I needed something to help with my stress. I'd been interested in meditation. And as I began reading some work by Daniel Siegel, a pioneer in the field, I saw how he was using mindfulness meditation in his practice and decided that's something that I needed to learn more about. Like a typical physician, I began reading Sharon Salzberg's book, Real Happiness, and Type A. I practiced meditation 20 minutes every day until I got it, above and beyond what she recommended. But despite that, after 2 weeks, I began to notice some changes in how I was feeling. And I felt like I had to share this with everyone, including my patients, to empower them with some control over their own lives. But why is this helpful? Let's go to a few basic studies and see why it's helpful. So our objectives here are going to be to name some conditions where mindfulness has been helpful, to describe some elements of the mindfulness practice, and be aware of some resources locally. So what is mindfulness? This phrase was coined by Dr. Jon Kabat-Zinn, paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Why is he important? Well, in 1979, Jon Kabat-Zinn, who was a psychologist at that time at the University of Massachusetts Medical School, put together his interest in psychology and meditation to create a secular program to treat patients with chronic illness and chronic pain who were not responding all the way to medication alone. So how is mindfulness practiced? Well, we start with our mind on a target, and that's where our attention lies. The target can be the breath, it can be a mantra, a sound, or a feeling like loving kindness or self-compassion. So when we're paying attention to our target, and in this case, it's going to be the breath, our attention will begin to wander every few seconds, and we'll leave the present moment of the breath, and we'll either be worrying or thinking or planning about the future, or we'll be ruminating about the past, what I didn't do, what I was supposed to do, what I said wrong. And so when our attention begins to wander, it brings us into the future or past where we may begin to develop some anxiety or dysphoria. So at that time, the important thing is to observe in a non-judgmental fashion the wandering of your mind, gently release those thoughts, and put your mind back on your target, which is your breath, because then we're once again in the present moment. And as Sharon Salzberg says in her book, the magic moment is the beginning again. It's not about clearing your mind. It's about noticing the thoughts and letting us go, which is training our mind to stay in the present moment. So the two programs that I'm going to talk about that are used in these studies here are mindfulness-based stress reduction and mindfulness-based cognitive therapy. The mindfulness-based stress reduction is the one developed by Jon Kabat-Zinn in 1979. In 1991, three cognitive psychologists put together a program in conjunction with Jon Kabat-Zinn and MBSR that marries together mindfulness and cognitive therapy to work on the negative cognitions of patients with anxiety or depression. And it also works for healthy individuals. I teach MBCT, and I've had a few physicians that didn't have any issues take the group to see how it could be helpful for their own patients. So both of the groups are 8 weeks long. There's a mindfulness facilitator. There's a class, it used to be in person, 2 hours once a week. I just did my first Zoom course of this summer. And the group aspect is very important because people can share barriers or problems they've encountered week to week with the home practice. Because there is a workbook and a CD or MP3s, and participants are asked to go home and practice up to 30 to 45 minutes a day with short meditation and workbook exercises. And then between the 6th and 8th week, usually there's a half-day silent retreat where we review all the types of meditation learned. And when we're focused on mindfulness, one of the things we do is we try to notice thoughts and feelings and sensations that we're having and let those go and come back to the breath. So MBCT is about treating depression and anxiety. And like I've said, I've also used it for individuals with just stress. And why is that effective? Well, there's an early study done here by the group that developed MBCT. And they had a group of maintenance antidepressant medication and a group of MBCT, as well as a placebo group that just received some clinical coaching. And over the 600 days, the estimated probability of relapse was significantly lower for the MBCT group, and it was similar to the maintenance antidepressant group. Now, does this mean I recommend patients to go off antidepressants? No, not at all. Some patients will continue to need antidepressants, but they may benefit from both, and those with mild depression may actually be able to do MBCT alone. And why is that? Well, cognitive reactivity is a point of having a dysphoric state where you begin to focus on negative ruminations and then go down into a depressive state. So if we look at the MBCT group, the amount of cognitive reactivity stayed low throughout the whole time period. Their scores on a Hamilton D depression score stayed low, where those on maintenance antidepressant without having done MBCT had very high scores when they had high cognitive reactivity. So how does the mindfulness work in these various courses? And it works similarly in MBSR and MBCT. We start when we're mindless and vulnerable from a place of non-awareness. We're not aware of what's going on in our mind, and our old patterns intrude, our poor coping skills, our wishes for things to be different, and we begin to worry. That then pushes us into our habits of negative coping skills, and we become more anxious and more depressed. So once we become mindful, it helps to prevent relapse When we begin to experience stress or anxiety or depression that are at a low level, and the old patterns begin to intrude, we can use our mindful awareness to have a calm and connected way to evaluate the situation. We begin to respond to situations rather than react to them. And we have the freedom to choose not to go into that stressed state. So is it good for our brain? Well, the next two slides are from an early study by Hotzel in 2010. And these scans were before and after the 8-week MBSR course. And the fascinating thing is, in the 8 weeks, these changes were significant. So yourself or patients don't have to be a monk that sits by a placid stream and meditates 8 hours a day. You can meditate. In this class, it was up to 30 to 40 minutes a day, but I encourage folks to start much shorter than that. But you can see over time, these stressed but otherwise healthy individuals developed an increase in their right-sided amygdala volume. And at the same time, the MRI scan showed changes in the hippocampus. And as you can see here, the left hippocampus increased with MBSR. And the reason that's important is it improves memory and learning, our self-referential thinking, emotional regulation, and persistence. So the changes, once again, to recap, there's an increase in gray matter volume in the posterior cingulate, the temporoparietal junction, the lateral cerebellum, and the cerebellar vermis and brainstem. So how does it affect the amygdala, and why is this important? Well, as Dr. Neff talked about earlier, our amygdala is our fight or flight center. And so when we begin to feel stressed or anxious, then our amygdala kind of discharges. So with learning the mindfulness process and becoming aware of what's going on at the time, becoming mindful of even mundane activities, which is called dispositional mindfulness, we develop over this learning process a shrinkage of our amygdala to decrease our fight or flight responses. So the short-term MBSR and MBCT courses demonstrate an increase in these areas, which increases the activity, connectivity, and volume in stress and healthy participants. There's a decreased activity in the amygdala, and so the exposure to emotional stimuli becomes less over time. So in the 8-week program, the changes were similar to long-term traditional meditators. And the emotional regulation and the improvement in the hippocampus suggests that over time, with aging, we may maintain some of our memory even more than folks who haven't done an MBCT or MBSR course or don't practice mindfulness. So why is this important to general medical conditions as well as psychiatric conditions? This is a very small study of patients with stage 4 cancer who were given an opportunity to do the MBSR-C course, which is an abbreviated MBSR course of only 6 weeks instead of the 8 weeks. And then the cortisol and the salivary IL-6 were measured at week 1 and week 6. And you can see here, there are significant improvements in all participants, both the patients and the caregivers at the end of the 8-week course. So further with the immune system, we can see that over time, and this is pre-intervention and after a 12-month follow-up, in these 3 areas, the T cell production, the stress inventory scores, and the salivary cortisol all have decreased significantly from the beginning before they started meditation. So once again, to recap, in a review of 20 randomized controlled studies with more than 1,600 participants, we saw that there was a decrease in inflammatory processes, an increase in cell-mediated immunity, and actually an increase in biological aging, meaning it slowed down our biological aging. This group is actually a mixed psychiatric group with multiple psychiatric disorders. And you can see here, after an MBCT course, this group on a quality of life scale showed significant improvements in physical and psychological health. And there was a mild improvement in social relationships. So in a review of 23 randomized controlled studies using patients with cancer, cardiovascular disease, chronic pain, depression, and anxiety disorders that had practiced MBSR, MBCT, you can see here the effectiveness of the mindfulness intervention compared with the control waitlist folks. And you can see decreases in depression, anxiety, stress, quality of life, and physical functioning. So in all of these medical conditions, as well as psychiatric conditions, there was significant improvement. So it's a non-pharmacological approach to chronic illness, and a review of 18 studies of MBSR showed evidence of improvement and decrease in stress, anxiety, and depression in psychiatric disorders, immune disorders, diabetes, hypertension, cancer, chronic pain, and sleep disorders. In one of my groups, there was a woman who was pregnant and was having increased blood sugars. And each time she had an elevated glucose, she sat down and did a 3-minute breathing space meditation, and her blood glucose normalized, which I thought was really fascinating. There's little risk in MBSR or MBCT, and it can improve patients and healthy individuals with stress control their lives in terms of quality of life, decreasing pain, decreasing mood swings. So how could you incorporate mindfulness meditation into your practice? The first thing is to raise the topic with patients, and we'll talk in the next slide about the barriers that are most frequently raised by patients, but to begin a dialogue with patients about meditation. You can provide handouts on the benefits of meditation. You can encourage the use of mindfulness apps, and I'll show 3 or 4 of them on a slide up ahead. You can refer to clinicians that specialize in mindfulness, and you can educate patients about the neurobiological benefits. Those initial slides of the MRI changes actually can be seen in a very simple layman's view type TED Talk by Sarah Lazar, L-A-Z-A-R, who was one of the authors of the papers by Hotzel. And I think being able to show in that video biological changes will really encourage patients and other participants, even, like I said, healthy individuals, friends, and family, to begin to think of meditation as a real intervention that can be helpful in their lives. The other thing is to begin or continue your own mindfulness practice. It really helps to be able to talk with patients about the pitfalls of mindfulness if you're a practitioner. It also decreases your own stress and your own reactivity and emotional reactivity to various situations that occur throughout the day. Just like Dr. Neff was talking about with the self-compassion, generally all types of mindfulness will increase your self-compassion to some degree. So these are the barriers that you'll receive from most patients when you begin to suggest it. The number one statement is, I can't meditate. So try to be curious and ask why. When I took up tennis about 10 years ago, my tennis coach said he was having problems with stress and anger. And I suggested, you could try meditation. And he said, I tried it once and it didn't work. And I said, yes, I tried one tennis lesson and I didn't go to Wimbledon. So the important thing is to be encouraging. And we'll talk later about why practice is so important, and just being aware and letting patients know that it's a slow practice. The next thing you'll hear is, I can't clear my mind. Well, meditation is not about clearing your mind. So if you can burst that bubble, that fallacy that patients or friends or people in general have, that's most important. You can let them know that mindfulness is about noticing your thoughts, your feelings, your emotions, and your body sensations, and then being able to notice them without judgment, let them go, and come back to the present. The next thing you'll hear is, I don't have time. And that's when you can answer, well, how about starting with a 3-minute breathing space, and direct them where to find that on the apps. The next barrier you will hear is, I can't sit still. And then you can recommend doing a walking meditation, which you can find on the apps also. So be prepared with answers for these 4 questions or 4 statements that you're going to get almost every time that you recommend a mindfulness practice. So this slide is rather old, because this was when we met in person to teach mindfulness, and there was an online course that was about a 4-week teaching course, and there was some ongoing assignments that were going over 2 months. It was called Be Mindful, and this comes out of England. And I can't tell you that I have the pounds correct to dollars, but it's under about $40 to do this online course. Nowadays, most all of the courses are online since COVID. The course I teach is online. There are other MBSR and MBCT courses that you can find nationally and locally online. And so patients don't have to leave their home. This makes it much easier and less of a barrier. You do lose some of the personal interaction in the MBSR and MBCT courses, but I do think it's still beneficial. And let's look at the Be Mindful course. Was it effective? So in the Be Mindful course, you'll see the depression scores on the PHQ-9 decreased significantly, and the anxiety scores on the GAT-7 decreased significantly. And that's after only the 4-week online course. So it is a valid program to recommend, either this or even the MBSR or MBCT. These are some popular apps. There's also the Calm app. There's 10% Happier. So there's numerous apps, and you may have your own favorite. My favorite is Insight Timer now. Insight Timer, the free version, has over 10,000 meditations for free, and they last anywhere from 1 minute to 2 hours. And you can do a search, putting in there, I need a meditation for anxiety. I need it to be 5 minutes, and I need it to be a man's voice with no music in the background. And they'll bring up one for you. There's groups on there also that you can join. And there is a log that keeps track of your meditation, not in a competitive way, hopefully, but it keeps track of every day that you meditate and how many minutes you're meditating. You can also write in a log how each meditation went if you like. There is a button on there where you can turn it off, or otherwise people can see a little dot of who's meditating and they can say, thanks for meditating with me. It shows little dots all over the whole world of who's meditating at that time. And I actually started a group for my MBCT graduates on there where everybody posts meditations. And I have just a brief Dr. Hauser's adult course and Dr. Hauser's adolescent course, where I've posted about 10 meditations for people to get started if they're curious. So if you want to teach MBSR, MBCT, I strongly recommend that you take a training course. I was fortunate to be able to do a training course with John Kabat-Zinn, who started MBSR, and Zindel Siegel, who started MBCT. And in the teacher training courses, you learn about pitfalls that can occur in teaching a group. And I think just reading the book is not enough to train and to be able to answer questions and, feel the hard topics that are going to come up. This is not a group therapy, and it's important not to get into the individual's problems, but to focus on meditation, and the training courses help to teach that. I just wanted to bring in this other program that incorporates meditation. This was started by two friends of mine here in Austin, Dr. Rakesh Jain, who's a psychiatrist, and his wife, Sandra Jain, who was a psychologist. They developed a program that has been studied. We'll look at the studies in a minute. It has a Kickstart 30 workbook that's about $6 on Amazon, and a 90-day workbook that is about $11 on Amazon. And the profits are donated to mental health charities. It's a 5-pointed program. And the points are exercise, mindfulness, sleep, social connectedness, and nutrition. It's exercising 30 minutes a day, which gets our brain chemistry going. Trying to do a mindfulness practice 10 minutes a day, which is actually where you begin to see EEG changes. Implementing 4 sleep hygiene practices, trying to call, text, or Zoom or video with FaceTime with 2 friends or family members each day, and logging your meals, snacks, and beverages without changing anything, just to log them. And the scores in studies, and they have about 10 posters that they've done and presented at conference, and you can see significant improvement in happiness, enthusiasm, resilience, optimism, depression, and anxiety, sleep quality. So this is something that you yourself can do from the workbook, or you can recommend to patients. It's a great wellness program. So what are your takeaways? One is that mindfulness is an effective clinical intervention for multiple disorders. It's an effective augmentation strategy that can be practiced daily, and it has a definite neurobiological impact. An important reminder for not only patients, but for ourselves is that it's a practice. It's just like learning piano. You have to practice your scales every day to be able to play the symphony, and you don't play that symphony in the first year. When I used to be a jogger or runner and I jog around Town Lake, some days I felt light and springy, and other days it felt terrible and muggy and humid and heavy, but I kept on up with the practice and eventually got where I could run or compete in the little fun runs. So the important thing is to stress with patients that they're growing neurons. It's going to take time. It doesn't happen overnight. It's like exercise. You're growing muscles in your brain. You're actually growing neurons, but I tell patients you're growing muscles in your brain. And it just like lifting weights or being on a diet, it takes a while to see increasing results. You do get some of the results after 8 weeks, but as you continue, you get more results. So I like to say, do you want to mindful or do you want to be mindful? And now I'd like to do a 3-minute breathing space meditation to end our program for today. So if you will get in a comfortable seated position, sitting straight up, and if you'll feel comfortable closing your eyes, we're going to do this mini meditation, which is a quick reset throughout the day when something happens and you may overreact to thoughts or feelings or body sensations. And this allows us to come back to the present and be more mindful. So sit straight if you can, put your feet on the floor. You can put your hands in your lap or on your knees. And if you feel comfortable, go ahead and close your eyes and we'll get started. So step one, become aware of what you're noticing in your mind. Begin to notice thoughts. Begin to notice any feelings that come up. And begin to notice any bodily sensations. You may notice that your shoulders are up and tense, and you may want to relax them and relax your face. And just notice the thoughts and feelings and body sensations without trying to change anything. And now let's move on to step two, which is gathering your attention. Begin to notice your breath. Focus on the feeling of your breath as you inhale and your belly expands. And as you exhale and your belly deflates. Continue to focus on your breath going in and out, a full inhale and a full exhale. Every couple of seconds, your mind will wander, and when it does, notice where it's gone without judgment. You can let that go and come back to the moment with your attention on your breath. Now, step three, begin to expand your awareness throughout your body as if your whole body is breathing. Holding in your awareness, your posture, your bodily sensations, your facial expression as you continue to breathe in and out. Come into this moment and be fully present. And when you're ready, take 3 slow, deep breaths, and you can open your eyes and carry this sense of awareness into the rest of your day.
The 5-minute